The first job of a physician is to do no harm. First, do not panic. The anatomy of a panic starts with two main ingredients: major change and uncertainty. It is the nature of human beings to fear the unknown. We are evolved to fear change because throughout the history of humanity, change almost always means something very dangerous, possibly an existential threat, is about to happen. Those who did not instinctively fear change were less likely to pass their genes on to the next generation, and their genes were selected out of the gene pool. Uncertainty about both what will happen and what you can do to mitigate your personal risk throws gasoline on fear's fire. A novel virus with the potential for death, no vaccine, uncertainty about contagion, uncertainty about treatment, rampant misinformation, a discredited news media, and a technological invention that allows everyone on earth to be a publisher without qualifications or barriers to entry might be the perfect recipe for an epic pandemic panic. Our legacy news media has previously lost all credibility when we actually need them the most. That is why the store shelves are empty of toilet paper and hand sanitizer. College students are partying at spring break, and politicians are seeking political gain from a tragedy. Stocking up on toilet paper is not on the list of CDC recommendations, and hand sanitizer is only recommended, quote, if soap and water is not available, unquote, for reasons that I will explain later. It is panic behavior. My goal is to halt the gasoline on the fire by educating you on known scientific principles that are well established in medicine. This is not about respirators or epidemiology, areas which I am not an expert. This is about my limited understanding of human nature, basic principles of health, translation of medical and political information, and empowering you with a sense of increased personal control over a distressing subject. I will give you my understanding of the why behind what the CDC and our leaders are trying to do. My name is Val Zudans. I am an eye surgeon who practices in Vero Beach, Florida. The first siren of alarm about Wuhan virus was from Li Wenliang, the Chinese ophthalmologist who first warned the world about this virus. He was imprisoned by his Chinese communist masters, forced by authorities to retract his warning, and later died from this novel pandemic, leaving behind his pregnant wife and child, as well as parents that were reported to be sick with a respiratory illness. British epidemiologists recently reported 95% of Chinese cases could have been prevented if social distancing and isolation had started 3 weeks earlier. Listening to Li Wenliang could have prevented massive human suffering and economic distress. As a fellow ophthalmologist, I feel particularly compelled to do those things that I am capable to carry on his legacy and share whatever information I have to help you if I can. Before I can do that, I must give a disclaimer. This is not medical advice. I am not your doctor. You should seek advice from your personal physician. This was also recorded on March 20th and is subject to change as more information becomes available. You should listen to the CDC, health departments, government officials, and your physician, not me, for personal medical advice. This is my attempt, though, to explain my understanding of the why of the CDC, government leaders, and doctor recommendations. How and when this ends is up to you and the general public. You have both the power to make the world a better place and the responsibility to do so. Promising developments are occurring rapidly, so there is great reason for hope. I will try to mitigate the panic by decreasing the uncertainty through sharing knowledge of why recommendations are being made, what you personally have the power to control, and why I am optimistic about what may happen. Irrational panic is a self-defeating strategy for surviving this pandemic. The most important thing right now is for as many of us as possible to avoid infection and survive infection when it occurs until we have proven treatments and safe preventative vaccines. This is a race in time. I hope to help you survive that long through education about what you can personally control. People who panic, especially those who perseverate on their panic at night instead of sleeping, are increasing their personal risk at no fault of their own. Panic and sleep deprivation suppress your immune system significantly, increasing your risk of contracting the virus when exposed, and increasing your risk of poor outcomes if you do contract the virus. Let me repeat, panic and sleep deprivation is seriously depressing to our immune systems and is a self-fulfilling prophecy. The CDC is saying all the right things, but unfortunately, their leadership is not being fully grasped and followed by the public. Almost always, the reason people do not follow leaders is because they do not understand the why behind the recommendations or orders, so I will do my best to explain the why. There are two basic components to this pandemic: transmission, also known as the R0, and lethality. R0 is the number of people each infected person passes the infection on to. Social distancing, mass shutdowns of much of our economy are primarily for the purpose of reducing R0. If everyone gets this virus all at once, the system does not have enough intensive care resources to simultaneously care for the subset of patients who are most sick and at risk of dying. Saving those human lives is the legitimate justification for mass disruption of our lives and our economy. The primary reason for social distancing is to slow down the spread of virus so that not everyone gets it all at once. The system can handle a gradual onslaught much better than a surge like they had in Italy. The system is so overwhelmed in Italy that, according to reports, they are prioritizing ventilators for the young over the elderly who are less likely to survive even with the ventilator. They are making rationing choices because they did not spread out the disease and had limited intensive care capacity to begin with. The secondary hope for social distancing is that the virus can actually be contained, as appears to have happened in Wuhan, China, and South Korea, where new cases are on the decline. There is much debate on whether that is possible in a culture like ours that places a much higher value on individual freedom. The why for strict separation of the elderly and infirm from the rest of us is that they are the ones most likely to die from this, rather than the young and healthy who have a relatively lower but not zero risk. The elderly, sick, and immunosuppressed are also the ones most likely to need the limited resources of intensive care units and respirators in particular. Interestingly, mass immunity from young, healthy people getting mild to moderate cases and recovering in the short run will serve as partial herd immunity for the unhealthy later, as long as the young do not interact with the older generation while sick. It appears that Britain is adopting more of this strategy. U.S. hospitals, nursing homes, and assisted living facilities have banned visitors to separate the greater community from those least capable of surviving this infection. Visit your grandmother by FaceTime or Skype, not in person. She needs to connect to you for her emotional well-being, but she needs it done in a safe way for her. There are breakdowns in how the CDC information is being consumed by the public, and is not necessarily the fault of anyone in particular, whether it is the CDC, the president, the news media, or the public. The information is there, but the news media is a mixture of both solid and sensational reporting, while social media tends to focus primarily on the sensational. The public is attracted instinctually to the sensational for the reasons I mentioned previously. They are also attracted to media confirmation of their existing bias, whether they think this is a nothing burger or the apocalypse. Very few are consuming news in an unemotional, rational way. They seek the news sources that tell them what they want to know about or to confirm their personal bias. There is a common saying in the news business: if it bleeds, it leads. I doubt human beings who lead news media have had a sudden epiphany. We also have too many armchair quarterbacks, maybe myself included. So I will do my best to focus primarily on my limited understanding of why the CDC, medical and government leaders are making their recommendations, not second-guessing prior decisions. I've had no direct conversation with the CDC and only cursory interactions with local government leaders This is my understanding based on my medical knowledge and reading. Social distancing, as stated above, is primarily intended to spread out infection over a greater period of time, and secondarily to try to contain the virus, especially to protect those who may die or disproportionately use the limited life-saving resources that we have while developing treatments and vaccines. Hopefully, understanding the why of social isolation will now help you follow our leaders' directions on social distancing. The second variable in this pandemic is lethality. Decreasing and slowing R0 alone decreases lethality because the medical system has more time to focus on treating each patient with sufficient resources for maximal medical management of each individual. Your greatest control over your personal situation, other than social distancing, is to reduce your odds of catching the virus when you are exposed and increasing your likelihood of surviving when you are infected by improving your immune system before potential exposure to virus. There are many known mechanisms to amp up your immune system, and they are the key before exposure to reducing both transmission and lethality. Anxiety causes your body to increase production of the stress hormone cortisol and reduces production of lymphocytes, white blood cells that fight infection. Stress and increased cortisol levels eventually lead to chronic inflammation, increasing the risk of arthritis, fibromyalgia, lupus, psoriasis, inflammatory bowel disease, cardiovascular problems, type 2 diabetes, various cancers, and dementia. Unfortunately, in Peggy Noonan's March 12th Wall Street Journal column titled, "Don't Panic is Rotten Advice," unquote, she makes her case for panic and even says, quote, "Sometimes paranoia is just good sense," unquote. In my opinion, she is wrong and is causing great harm to herself and anyone who listens to her advice. Most conventional wisdom is that there is nothing that you can do about stress. Conventional wisdom is often as wrong as Noonan. The conventional layperson solutions are wrong, like alcohol and benzodiazepines. They may seem effective in the short run, but they're certainly harmful in the long run. Anxiety increases with long-term use of benzodiazepines. But there are two interventions that have been scientifically shown to reduce stress, or at least allow you to better cope with stress and improve your immune system. Mindful meditation and exercise have both been shown to provide measurable improvements in immunity, including circulating inflammatory proteins, inflammatory gene expression, immune cell counts, immune cell aging, and antibody response. This is why you should exercise and incorporate mindful meditation in your daily routine, not just for this virus, but for living a healthier life in general. In my opinion, and that of others, even more important than reducing stress, the number one controllable intervention that you can make in your life and safely recommend to others as well is to get at least 7 hours of quality sleep every night. This is not an old wives' tale. The science is undeniable. In a University of California, San Francisco study published in 2015, volunteers were administered nasal droplets of rhinovirus, the most common, very contagious cold virus, after measuring their sleep the week prior. If you had less than 5 hours of sleep, there was a 450% greater chance of catching the virus compared to those who had over 7 hours of sleep. The people who had over 7 hours of sleep, despite getting droplets of virus in their nose, only had about a 15% chance of catching that virus. There are many interventions that can improve your sleep, known as sleep hygiene, that are beyond this talk. You may also have a common sleep disorder like sleep apnea, snoring, or insomnia that definitely should be addressed. A great resource on this issue is Dr. Matthew Walker's book, Why We Sleep. One of the simplest ways to improve your sleep is to measure it. Wearing a Fitbit or other wearable that measures sleep, including stages, and reviewing your results daily has been shown in studies to improve sleep patterns through biofeedback. People who track their sleep are more consistent with their bedtimes, wake-up times, sleep quality and duration, and post-sleep functioning. A couple of simple pearls to improve sleep include setting the thermostat to 69 degrees Fahrenheit. Your body does have to drop 2 to 3 degrees Fahrenheit in order to fall asleep. blackout curtains, set bedtimes and wake up times, avoiding TV, and in particular, blue LED lights after sunset, and limiting caffeine only to the morning time, if at all. With proper sleep hygiene, you should be waking up in the morning without an alarm clock, feeling rested without caffeine. If not, I personally would seek help from a sleep medicine specialist. In 1918, the Spanish flu caused a novel pandemic that was undeniably worse than our current situation, in an era with no antibiotics, flu vaccines, or modern respirators. The Boston area was particularly hard hit. Perceptive physicians there recognized that their patients who were confined to ships, military barracks, and other poorly ventilated quarters were particularly hard hit. They had the brilliant idea of outdoor tents and daily sun exposure for their seriously ill patients. One report documented reduction of hospital deaths with open air therapy from 40% to 13%. Open air therapy was the precursor to eventual positive pressure ventilation in our ORs and ICUs today. It is a known fact that open air and sunlight are both antimicrobial. It is also a known fact that vitamin D deficiencies are associated with increased mortality from infections in intensive care units. Sun exposure dramatically improves our immune system, which not only allows us to survive infection, it protects us from many types of cancer, as our immune system plays a critical role in surveillance against cancer. Vitamin D deficiency is also associated with increased cancer rates in numerous types of cancers. Just being outdoors increases white blood cell counts, presumably from breathing plant-produced airborne chemicals that they are using in their biological warfare against pathogens that could affect plants. Spending time outdoors allows us to piggyback on their defenses. I personally try and get 30 minutes of unprotected sun, except on my face because I don't want wrinkles. As much outdoor time as possible, and we open the doors and windows whenever the weather allows. In Florida, going to the beach while maintaining social distancing at the same time may be the most healthy and protective activity available, provided that the groups are small and you maintain your social distancing. With hand washing, the CDC on their website recommends 20 seconds of hand washing with soap and water. Hand sanitizer is only recommended in the event that soap and water is not available. Is there anyone who recently bought hand sanitizer who did not have access to soap and water? I doubt it. The store shelves and price gouging suggest a lack of knowledge. What panicked hand sanitizers do not realize, though, is that hand sanitizer not only kills bad bacteria and virus on your skin, it also kills the good bacteria on your skin, and to some extent, even the good bacteria in your gut. Both your skin and gut biome are primary immune defenses against microorganisms. On top of this, many of the people who are dying of this condition die from septic shock from secondary infections. Septic shock is a deadly condition where bacteria enter the bloodstream and then cause hypotension, excessively low blood pressure, leading to death. It is not the virus causing sepsis, it is secondary. It is the breakdown of the intestinal cell membranes or the lung membranes that allows the bacteria, whether it's the gut bacteria or bacteria secondary infections in the lung, to pass into the bloodstream, leading to sepsis, which is blood infection, subsequent hypotensive shock, and then death. Rather than compromising my gut biome and my skin biome with hand sanitizers, I follow the CDC recommendations and use soap and water for 20 seconds, and you probably should too. You can further boost your immune system by building up your healthy gut biome. Some readily available fermented foods that will enhance your gut biome are yogurt, kimchi, sauerkraut, kombucha, miso, kefir, fermented vegetables like pickles, dark chocolate, which is one of my favorites, apple cider vinegar, and probiotics. There's also something called prebiotics, such as fructooligosaccharides or FOS. These are sugars that humans cannot digest, but are great fuel for the good bacteria in your gut. I personally like kimchi and kombucha and try and have both, as well as dark chocolate, and take the FOS daily. And I like to try and eat fermented foods as much as possible. What does fasting do to your immune system? I'm glad you asked. In 2014, Walter Longo at USC reported that a 3-day fast essentially reset your immune system by removing the old immune cells, and then after you broke the fast, replacing them with a new set derived from your immune stem cells, much younger, healthier immune cells. A December 2019 article in the New England Journal of Medicine suggested that other fasting strategies, such as intermittent fasting or time-restricted eating, has many of the same benefits. Because our immune system is not just for infection, it's also for cancer, there are some interesting studies out there. Various studies show that fasting or intermittent fasting associated with chemotherapy can be quite effective in reducing chemotherapy toxicity, as well as effectiveness of chemotherapy agents, and even after chemotherapy, reduced recurrence rates of breast cancer and other cancers. I personally intermittently fast just about every day, and I do a prolonged fast of up to 1 week, 4 times a year. As for my optimism, I am probably more optimistic than many of my colleagues. If we can just delay the onset a little longer, it looks like we have many promising treatments. Previously approved malaria and HIV drugs have shown great promise, and U.S. physicians are legally permitted to prescribe off-label uses. Convalescent serum has also been used in prior pandemics and this pandemic with success. Vaccines are already in trial but will not be available in the short run. Chloroquine has been reported in China, South Korea, Australia, and France to shorten the course of infection with the Wuhan virus. Chloroquine, or its analog, hydroxychloroquine, known as Plaquenil, is readily available and cheap. Bayer Pharmaceuticals announced the donation of 3 million chloroquine tablets to the effort. Quinine, readily available in the form of tonic water, has a related mechanism of action and is available on your grocery store shelf without a prescription, at least until the conclusion of this video, assuming anyone watches it. There is also the Japanese flu drug, favipiravir, that has shown promise in shortening the disease and improving lung condition. That is not FDA approved, but there is already ongoing efforts to potentially make that available to US physicians despite the lack of FDA approval. Similar hope is being placed in other antivirals developed for HIV. Convalescent serum, plasma from people who have already recovered from coronavirus, is likely to work for both treatment of coronavirus patients as well as prophylaxis in much smaller doses for healthcare workers. The process, unfortunately, is cumbersome and not easily scalable, particularly for treatment. Its proper role may be in small doses of 5 milliliters as prophylaxis for healthcare workers. Caution is in order for some of the potential vaccines, as they are unlikely to be available anytime soon, and there have been serious setbacks in the past with prior attempts at creating vaccines against other strains of coronavirus that unfortunately caused a hypersensitivity of the immune response, making matters worse. I could be wrong, but I am very hopeful that this will pass much sooner and in a less devastating manner than most are claiming. That is not intended to diminish our leaders' admonitions. If we don't listen and social distance, this will be worse than some of them are even saying. But I trust the American people to overall do the right thing. I do think that chloroquine and the other readily available treatments are going to decrease both R0 and lethality, and we are going to dodge the bullet and our economy will recover rapidly. I think this too is a self-fulfilling prophecy. If we can get through this, we will be stronger as a nation with renewed meaning in our lives. Last but not least, my final thought about this entire matter is about prayer. There is real scientific evidence that prayer affects outcomes. It is hard for me to fathom as a scientist, but it is real. Some may say that it is merely a placebo effect. Well, if so, the placebo effect is both real and quite powerful in medicine with little to no side effects. Count me in. I am praying for our president, all of our leaders, doctors and scientists, the media, my family and friends, those who are already sick, and every person who watches this video. May God bless you, protect you, keep you safe, make your immune system strong and healthy, and protect you from the evil of the world. I pray that this is helpful in reducing your stress, improving your sense of control over your personal situation, brings you peace, and helps you to know my Lord and Savior, Jesus Christ. Thank you.